My name is Dr. Sanjay Kamble. On behalf of Wockhardt medical team, Wockhardt RSSDI TV 2021, I welcome you all. We are privileged to have Dr. Vitul Gupta sir with us today, and sir has a very important talk in today's meeting. That is the challenges in patient education for diabetes mellitus, which is often a much problematic thing which is observed by the physicians during their busy practice, who really cannot give time to the patients. And to ask on these key challenges, what challenges are usually faced, I would like to ask Dr. Vitul Gupta sir, what do he wants to convey to our audiences today about educating their patients, how important it is, and what should be the strategy to effectively communicate these things to our patients.
Thank you very much for inviting me for such a informative talk. And the message has to go from the media only. And I think since India is becoming a diabetic capital of the world, only one thing can stop this epidemic, that is education. Whatever hospitals we build, how many patients we treat, they are not going to be effective until and unless we prevent diabetes. And prevention is from education. Since diabetes is a lifestyle disease, so educating the patients as well as the doctors. For me, educating the doctors is very, very important. Since we have done a lot of studies on this, even 90% of the patient don't know the target blood sugar to be achieved, which is the duty of the physician. Physician just take 5 seconds to tell the patient that what target you should achieve. So most important challenge we face is that patient don't get information from anywhere. So we need to, as RSSDI, as all the stakeholders in medical profession, along with government, need to propagate, need to educate through various medias. In world of technology today, we have so many methods to transfer education to all the people. So we need to educate the people, and challenge we face is of infrastructure, of manpower. We don't have diabetes educators as such. Dr. V. Mohan has started a course in 2011, but still many has to be done, and I must appreciate the efforts of RSSDI under Dr. Bansi Sabu, Dr. Sunil Gupta from Nagpur, and Dr. V. Mohan. I think these 3 people are the heroes who are working a lot on educating the patients. So we need to educate to arrest the epidemic of diabetes, and education is on lifestyle, that is control of your weight, the nutritional aspect, exercise, which is going to be effective in all the non-communicable diseases. And diabetes is the basic disease. If we control diabetes, we are controlling heart disease, we are controlling the cerebrovascular diseases, we are controlling other lifestyle diseases, we are controlling the kidney diseases, we are controlling the peripheral vascular diseases. So I think whole emphasis today should be on education of patients as well as physicians on the topic of diabetes, if we really want to arrest the epidemic of diabetes. Thank you.
Thank you, sir, for those key words and those key messages. We really look forward to attend your talk, and definitely that would be a great thing for all of the physicians, all of the delegates attending, and really wanted to see what they can do for the best for the patients when it comes to the patient education. Thank you, sir.
Thank you. Thank you.